The purpose of using personal protective equipment is to reduce or eliminate the presence of microorganisms in order to prevent the spread of infection. The contact and droplet precautions are used in order to protect yourself, immunocompromised patients, and the general public. First, we want to clean our hands for 20 to 30 seconds with hand sanitizer or 40 to 60 seconds with soap. Staff and visitors are required to wear a gown and gloves but are advised to wear a mask as well. Patients should be wearing facial protection and a clean gown before leaving the room. The different components of PPE are gloves, which protect our hands from fluids and pathogens. They're not 100% effective though, since they wear down with time, so you should replace them often. Also, we wear gowns, which protect our skin and clothing from fluids and pathogens. Masks, which protect our mouth and nose from inhaling pathogens, along with protecting our respiratory tract from airborne infectious agents. And eye shields, which protect our eyes from bodily fluids and pathogens. This is how we don. First, we wash our hands. And then we put our gown on, avoiding touching the outer edges so we don't contaminate it too much. And you want to tie it at the top. And then also at the bottom. After that, we put our mask on, which includes our eye protection. Mouth and eye protection is on, and then we take our gloves and put them over your gown so that nothing touches your skin. And we're done! This is how we doff. First, we take off our gloves, avoiding touching our skin. We want to roll them into themselves and avoid touching the other glove with your bare skin. And then those go in the garbage. Then we perform hand hygiene by either washing our hands with soap and water or using hand sanitizer. And then you're going to take off your mask, undoing the bottom string first, and then the top string, and leaning over into the garbage. Then we perform hand hygiene again, keeping in mind we can use hand sanitizer too. Next, we want to take off our gown. So first we're going to untie the top. And then we're going to untie the bottom, avoiding touching the actual gown. And then we're just going to try and shimmy it off, as we don't want to get any pathogens on our hands. And you're going to roll it into itself, into the garbage can. And then you'd wash your hands again. And that's how you doff.